This conference will now be recorded.
Hi guys, my name is LaDonna Cavanis and I am an instructor here at Ultimate Medical Academy. Today we're going to be going over the lymphatic and the immune systems. So, related combining forms. So, when we talk about the lymphatic system, the structure would be lymph, the lymph vessels and ducts, the lymph nodes, the tonsils and adenoids, the spleen, the bone marrow, the lymphocytes, and the thymus. When we when we break the lymph down into the combining form, LYMPH with the combining vowel O, lympho, LYMPHANGIO, lymphatic vessel of the duct. LYMPHADENO, lymph nodes. TONSILLO, tonsils. ADENOIDO, adenoids. SPLEN, the combining vowel O, spleen. MYELO, bone marrow. LYMPHOCYTO, lymphocytes. THYMO refers to the thymus. All right. Functions of the lymphatic system. Three main functions: absorption of fat and fat-soluble vitamins through lacteals of small intestines, removal of waste products and tissues, and cooperation with the immune system in destroying invading pathogens, returning filtered lymphs to veins at the base of the neck. Absorption of fat and fat-soluble vitamins. Villi, located in the small intestine, contain lacteals and blood vessels. Lacteals are specialized to absorb fat, not transport by bloodstream. Lymphatic vessels return them to venous circulation to be used throughout the body as nutrients. Interstitial fluid and lymph. Interstitial fluid, plasma from arterial blood that delivers nutrients, oxygen, and hormones to cells. 90% of this fluid returns to the bloodstream. Lymph, remaining 10% of interstitial fluid, contains electrolytes and proteins. Structures of the lymphatic system. And this is just a diagram, 1 of 8. Structures of the lymphatic system. Lymphatic circulation depends on pumping motion of muscle to move fluid upward. It flows in only one direction, upward to the circulatory system at the base of the neck. Vessels are not visible since lymph is a clear fluid. Lymphatic capillaries, microscopic blind end tubes near the surface of the body. Brief separation of cells and capillary walls allow lymphs to enter capillaries. Closing of these cells and capillary walls forces lymph to flow upward and forward. This is just an image here. Okay. All right, lymphatic vessels and ducts. Valves prevent backward flow of lymph. Large lymphatic vessels join to form 2 ducts. Right lymphatic duct collects lymph from right side of head and neck, upper right quadrant of the body, and the right arm, and empties into the right subclavian vein. Lymphatic vessels and ducts. Thoracic duct collects lymph from left side of the head and neck, upper left quadrant of the trunk and left arm, lower portion of the trunk and both legs, and empties into the left subclavian vein. Lymph nodes specialize lymphatic capable of destroying pathogens. Three major groups: cervical lymph nodes located along the side of the neck, axillary lymph nodes located under the arms, and inguinal lymph nodes located in the inguinal area of the lower abdomen or the groin area. Lymphocytes. Lymphocytes form in bone marrow as stem cells, assist in defining blood against antigens. And this is the breakdown of the term lymphocytes. LYMPH with the combining vowel O means lymph, and cytes refers to cells. Three types. Natural killer cells aid in killing cancer cells. B cells produce antibodies, and T cells play a role in mediating immunity. Cytokines. It's a group of proteins released primarily by T cells. Begin the immune response. Interferons, it produced in response to antigens, and interleukins direct B and T cells to divide the proliferate. All right, here's just another image of additional structures of the lymphatic system. Some structures are made of lymphoid tissue, tonsils. This type include adenoids, palatine tonsils, linguinal tonsils, form protective ring around the back of the nose and upper throat, and it prevents pathogens from entering the respiratory system. And this is just an image of the palatine and the tonsils and adenoids. Thymus gland. It's located above the heart. It reaches greatest size at puberty and decreases in size with age. Vermiform appendix. It hangs over the lower portion of the cecum. Exact purpose unknown, but may play a role in immune system. The spleen. It's located at the left lower quadrant of the abdominal, just above the diaphragm and below the stomach. Numerous functions include, but are not limited to, filtering of microorganisms and other foreign material from the blood, and formation of lymphocytes and monocytes. And this is just another diagram of the spleen and the liver and the stomach, the large and small intestines. Functions and structures of the immune system. Protects the body from pathogens, allergens, toxins, or malignant cells. Destruction of harmful substances that enter into the body, and identification and attacks on antigens. Intact skin, physical barrier against the invading organisms. Respiratory system, nose, hair, and moist mucous membrane trapped breathed in foreign matter. Digestive system, uses acids, enzymes to destroy invaders that are swallowed or consumed with fluid. Lymphatic system, specialized leukocytes attack and destroy pathogens that have succeeded in entering the body. Binding of antigens to antibodies, labels potentially dangerous antigens so that it is recognized and destroyed. Tolerance acquires unresponsiveness to specific antigens. Antibodies, disease-fighting proteins. Bind with specific antigens in antigen body responses. 5 primary types. Immunoglobulin G in blood, serum, and lymph. Immunoglobulin A produced against ingestive antigens. Immunoglobulin M found in circulating blood fluids. Immunoglobulin D found only on the surface of the B cells. Immunoglobulin E, produced in lungs, skin, mucous membranes, responsible for allergic reactions. Phagocytes, specialized leukocytes acting as part of an antigen, antibody reaction, destroy cells, debris, dust, pollen, pathogens by phagocytosis, PHAGO to eat or swallow. Include monocytes, macrophages. Macro, M-A-C-R-O, means large, and phage, P-H-A-G-E, means a cell that eats. Dendrite cells. Complement system, group of proteins normally circulating in the blood in an active form, combined with antibodies to dissolve and remove pathogen bacteria and other foreign cells when needed. State immunity is the state of being resistant to a specific disease. Natural immunity, resistance to disease, is present without administration of antigen or exposure to disease, present at birth or is passed from mother to child through breast milk. Acquired immunity, obtained by having had a contagious disease, being vaccinated against a contagious disease, or boost vaccination may be required. Medical specialties related to the lymphatic immune system. So an allergist diagnoses and treats conditions of altered immunogenic reactivity, such as allergic reactions. Diagnoses and treats disorders of the immune system. Medical specialties related to the lymphatic and the immune systems. Lymphologists, they diagnose and treat disorders of the lymphatic systems. Oncologists, ONC means tumor, diagnoses and treatments of malignant diseases. Lymphadenditis, it's inflammation of the lymph nodes. Lymphadenectomy is removal of the lymph nodes. And lymphangioma is benign tumor, abnormal collection of lymphatic vessels, congenital malformation. Pathology and diagnostic procedures. So ruptured spleen is a medical emergency. Covering of the spleen is torn. Splenoregia is bleeding of the spleen. And when you break that down, SPLENO means spleen, and regia, RRHAGIA, refers to bleeding. Splenomegaly is an abnormal enlargement of the spleen, and lymphoscintigraphy is a diagnostic test to detect damage or malformations in the lymphatic vessels. Lymphedema, it's swelling of the tissues due to accumulation of lymph fluid within the tissues due to inadequate draining of the lymph. Often associated with infection. Primary lymphedema is hereditary. Swelling begins in the feet and progresses upward toward the legs. Secondary lymphedema is due to damage to the lymphatic vessels. Bioimpedance spectroscopy, non-invasive method of diagnosing lymphedema, measures resistance to electrical current passing along the affected limb. Allergic reaction, body's immune system reacts to harmless allergens as it were a dangerous invader. Allergy, overreaction by the body to a particular antigen. Allergen, substance producing allergic reaction. Localized allergic response. Redness, itchy, burning, where skin came into contact with an allergen. Systemic reaction, severe response to allergen, also known as anaphylaxis. And this is a medical emergency. Scratch test, it's a diagnostic test to identify common allergies. Allergen-specific immunoglobulin, blood test to determine if a person is allergic to a particular substance. Antihistamines, medications to relieve or prevent symptoms of certain allergies. Autoimmune diseases, it's a group of diseases. Immune system produces antibodies against its own tissues. It may be genetic. Immunodeficiency disorder, it's a severe combined immunodeficiency. Could be inherited, increased susceptibility to infections, and failure to thrive due to infection. Immunodeficiency disorder, HIV, human immunodeficiency virus. It's a blood-borne infection. It damages the T cells. It causes increased risk of opportunist infections. Acquired immunodeficiency syndrome, most advanced and fatal stage of HIV infection. There's no cure, treatment combinations of different drugs. Kaposi sarcoma, opportunist disease frequently associated with HIV. Elysia, enzyme-like immunosorbent assay. It screens for presence of HIV antibodies. Westbourne blood test. It produces more accurate results than ELISA. Immunotherapy, and this is the breakdown. Immuno means immune, and therapy, treatment, stimulating or repressing the immune response. Treatment of cancer's immune response is stimulant to frequent malignancy. Treatment of allergies, body sensitivity to a particular allergen is repressed. Antibody therapy, synthetic immunoglobulins, post-exposure, preventative measure, synthetic inferior, treatment of multiple sclerosis, hepatitis C, and some cancers, monoclonal antibiotics produced in a laboratory by identical offsprings of the clone of a specific cell. Immunosuppressant. It prevents, reduces body normal immune responses. Corticosteroid drug, it's a hormone-like drug used as anti-inflammatory or immunosuppressant. Cytotoxic drug, and the breakdown is cyto, CYTO, cell, tox, TOX, poison. IC, always pertaining to medication that kills a dangerous cell. Bacteria, one-celled microscopic organism. Most are not pathogenic. Pathogenic bacteria includes, but is not limited to, bacilli, rod-shaped sponge formed bacteria, bacilli rod-shaped. Anthrax, transmitted through livestock. Rickettsia lives in lice, fleas, ticks, and mites. Spiral-shaped bacteria capable of movement. Pathogenic bacteria include Lyme disease, transmitted by the bite of a tick, Staphylococcia, group of 30 species shaped like clusters, and this is the breakdown of that term. Example, Staphylococcus aureus, infection in the womb, and Staphylococca bacteria that form at a chain. Antibiotic-resistant bacteria occur when surviving bacteria become resistant to a particular drug. Example of this would be methicillin-resistant Staphylococcus aureus. Difficult to treat, can be fatal. Fungus and yeast infections. Fungus, parasite organisms can be harmless or pathogenic. Yeast infections occur on the skin or mucous membranes in moist areas caused by pathogenic yeast Candida albicans. Viral infections consist of Ebola transmitted by contact with any bodily fluid infected with Ebola virus, influenza, viral respiratory infection. Measles are transmitted by respiratory droplets of the Ebola virus. Mumps, swelling of the parotid glands, salivary glands located in the front of the ears. Rubella, known as the German measles or 3-day measles. MMR immunization can prevent mumps, measles, and rubella. Viral infections, rabies transmitted to human bites or saliva or infected animal. West Nile virus can be spread to humans by the bite of an infected mosquito. Breast cancer. It develops from the breast cells and many metastasize to lymph nodes and other body sites. BRCA1 or BRCA2 genes. Abnormal genes occurring higher risk of breast, ovary, and certain other cancers. Ductal carcinoma in situ, breast cancer at its earliest stage. Inflammatory breast cancer. It's an aggressive form of breast cancer. Cancer cells block lymphatic vessels in the skin of the breast, cannot be detected by mammography. Male breast cancers may occur in small amounts of breast tissue normally present in males. Stages of breast cancer. Stage 0, cancer cells found only in one location. Stage 2, cancer cells are beyond the duct but not in the lymph nodes. Stage 3, cancer has reached 1 or 3 axillary lymph nodes. Stage 3, cancer has spread to the cervical lymph nodes and other tissues surrounding the breast. Stage 4, cancer has spread to other organs such as the brain, liver, or bones. Breast self-examination, self-care procedure, palpation of the breast, performed by healthcare provider for texture, size, consistency of breast, and mammography. It's a radiographic examination of the breast. Break the medical term mammography down. MAMMO, which means breast, graphy, the process of producing a picture or record. Molecule breast imaging is a nuclear medicine technique. Ultrasound may be a follow-up procedure if abnormality finding of a mammography. Needle breast biopsy. This is for detection of breast cancer. X-ray or MRI guided needle removes small samples of tissue from the diagnosis and planning of treatment. BI pertaining to and life, OPSY is view of. Surgical biopsy, removal of small amounts of tissue for examination and to confirm diagnosis. Sentinel lymph node biopsy, it's a biopsy of first lymph node to come in contact with the cancer cells. Lymph node dissection is removal of the lymph nodes to determine or slow the spread of cancer. Lumpectomy is a removal of only the cancerous tissue with surrounding margins of normal tissue. Mastectomy is removal of the breast nipple. MAST means breast, and ectomy is surgical remove, may be radical or modified radical. Breast reconstruction. Immediate breast reconstruction begins during the same surgery as the mastectomy. Delayed breast reconstruction performed after completion of radiation therapy. Cancer treatments. Surgery, removal of malignancy plus margins of surrounding tissue, chemotherapy, use of chemical agents such as anti-neoplastic or cytotoxic medications. Radiation therapy, use of brachytherapy, teletherapy, and tomotherapy. Pernicious anemia due to body's inability to absorb vitamin B12. These are blood disorders. Hemolytic anemia. Hemo means related to the blood, and lytic or lytic to destroy. Inadequate number of circulating red blood cells. Premature destruction of red blood cells by the spleen. All right. Thank you guys for joining me in my presentation today.